Good afternoon. Welcome to the congressional briefing on the real dangers of equating opioid dependence with addiction. My name is Dr. Diana Fishbein from Pennsylvania State University and co-director with Dr. John Roman of the National Prevention Science Coalition to Improve Lives, one of the briefing sponsors. Other sponsors include the Congressional Addiction Treatment and Recovery Caucus and RTI International. The rates of opioid misuse in this country has led to a national crisis that should not be underestimated. As you can see in this slide, all segments of our society are affected. All age groups from fetuses to the elderly, all socioeconomic classes, all races, all ethnicities, and many of them are dying. In places where the problem is most concentrated, it has shattered the very fabric of those communities and placed a tremendous strain on the whole range of social systems that are otherwise there to serve us. It is quite apparent that we have not yet found a solution to this monumental problem. The Addiction Treatment and Recovery Caucus was formed to address this looming issue at the federal level, with direct implications for formulating state and local level policies. The sponsors of this caucus include Representative Tim Ryan, Democrat from Ohio, James Sensenbrenner, Republican from Wisconsin, Paul Tonko, Democrat from New York, and Dave Joyce, Republican from Ohio. Their mandate, as stated, is to educate and raise awareness among lawmakers about substance abuse and addiction, both prevention and treatment. An additional resource aimed at tackling the opioid crisis is the National Prevention Science Coalition. We have recently launched the Congressional Prevention Policy Caucus to inform lawmakers and federal and state agencies about the scientific knowledge that has been amassed, demonstrating the value and cost benefits of preventive approaches to many behavioral and mental health problems. Today, our members include Representative Donna Shalala from Florida and Representative Bobby Scott, Democrat from Virginia. We are continuing to recruit additional members, and several have expressed interest. Our mandate is to connect congressional members with prevention science experts to promote the use of evidence-based solutions known to prevent behavioral and mental health problems. Ultimately, prevention strategies promise to reduce costs relative to more reactionary approaches. The National Prevention Science Coalition to Improve Lives is a large organization made up of hundreds of scientists from across a number of disciplines, as well as educators, clinicians, practitioners, national organizations, community stakeholders, and policymakers, with a collective vision to translate scientific knowledge into effective and sustainable practices, systems, and policies. The science, an understanding of that science, uncovers oftentimes important evidence that can be easily obscured in the daily grind of policymaking. This discussion of the differences between addiction and dependence is a prime example. Our regulatory laws and our criminal codes do not recognize the distinction between addiction and dependence, and that lack of recognition has led to some dire consequences. Just briefly, physical dependence occurs when the body adapts to the presence of a drug, generally over a long period of time, and requires more of it to achieve a certain effect, which is called tolerance. And if you withdraw from the drug when dependent, it can trigger physical and mental symptoms, particularly if the drug is abruptly withdrawn. So basically, physical dependence occurs when individuals need to function normally, as with the use of pain medications, prescription pain medications, even if taken as instructed, can lead to dependence. And individuals under these circumstances need the drugs to function normally in their lives. Addiction, on the other hand, is known to cause compulsive behavior. This is the hallmark sign of addiction, is compulsivity, and that is the inability to stop using a drug. And the individual fails to meet work, social, and family obligations, and sometimes, depending on the drug, will experience tolerance and withdrawal. So it's a very different phenomena where individuals will go to great lengths to obtain a drug, and frequently, if they do not have access to a drug that they are addicted to, they will seek various means to obtain it, such as eventually looking for it on the street and sometimes taking illicit drugs such as heroin. So physical dependence in and of itself does not constitute addiction, but it often accompanies addiction. And so you can see that medically and from a public health perspective, these are very different phenomena, and the policy implications of these differences are really significant. A really solid drug policy would reflect these differences in the risks and needs of these two populations. The neglect for the scientific evidence that has been obscured by these many misconceptions about the differences between addiction and dependence has led to a number of ill-conceived policies. It's important to recognize that pain patients include our veterans, ex-athletes, caregivers, laborers, anybody could have a dependence on opioids due to legitimate pain needs. If we continue to indiscriminately roll out policies that make these pain medications inaccessible to patients who need them, we will see more suicides, more depression, higher rates of unemployment in this population, the inability to care for themselves and their families, and in general, a lot of pain and needless suffering. I will tell you that a friend of mine last year who took care of her son for 28 years due to multiple physical disabilities, she had developed severe back problems and had become dependent on opioids that she needed to function normally to care for herself and her family. Her doctor gave her 3 weeks suddenly to withdraw from these medications without any help for the withdrawal process, no alternative medications, no support that she needed. And during the course of those 2 weeks, as her pain began to resurge, she committed suicide. So she is no longer there now to care for her son or her elderly husband. Another fact that we need to be more familiar with is the fact that the percentage of individuals who die from opioid overdose due to legitimate pain medication is actually quite tiny. The use of fentanyl and heroin, the illicit use, has accounted for the vast majority of opioid overdose deaths. And in fact, only about 1% of cases involved drugs that people were taking legitimately for their pain needs. And finally, I want to bring out the important role of stigma in all of this, and that with the opioid crisis, the stigma around the use of opioids has really become very prominent. People don't think much of individuals who are using opioids, even if they're using them, even if there are vets and are athletes, even if they're using them legitimately. And so individuals who need these drugs for their pain relief to function in their lives are, their voice has been silenced due to stigma. Over and above that, individuals who are addicted oftentimes don't now seek treatment because of the stigma. So our caregivers and other individuals in our society are not getting the treatment that they need. This briefing will cover the whole range of issues that have been raised by rolling out policies that do not recognize the distinctions between addiction and dependence. We start with the basic science that will be presented by Dr. Nora Volkow. She is the director of the National Institute on Drug Abuse at NIH, and she will discuss the basic knowledge that has been amassed from the perspective of neurobiology and discuss the differences between addiction and dependence and why it is so important for us to recognize them when formulating policies. Dr. Susan Glaude is a palliative pain specialist from Hershey Medical. She treats end-of-life patients who are significantly suffering and require pain medication to simply just to tolerate the end stage that they are in, and are now suffering even more from having limitations placed on their access to pain medication. Dr. Patrick Byrne, who is a fellow at the University of Texas, suffered a spinal cord injury a couple of years ago and has personally experienced some of the issues that have arisen because of recent policies that don't recognize this distinction. So he will give you a personal perspective as a pain patient, but also with the knowledge given his own career course of why it is so important that we take into account the science. Dr. Brendan Soliner is from Johns Hopkins University. He studies individuals with opioid use disorder and he treats them as a clinician. So he has a different perspective on how individuals with addiction deal with their disorder and the types of treatments that are available to them. And so he will provide that perspective. Dr. Philip Graham from RTI International is a prevention scientist. Prevention should not be underestimated in really addressing all aspects of the equation. There is ample evidence showing that there are signs and symptoms and experiences and so forth that indicate that when individuals are going down a pathway that might lead to addiction. And importantly, prevention science indicates ways in which we can disrupt those pathways towards addiction by addressing them early, preventing the exposure, for example, to adversity, and preventing the adverse effects when we are not able to prevent the actual exposure. So he will discuss prevention policy from that perspective. There will be plenty of time towards the end of this briefing for questions, so I will start by introducing our first speaker.